Hi, I'm Danny Ham, Vice President of Sales for InterMed Nuclear Medicine Services in Alachua, Florida. As many of you know, CMS has mandated that nuclear labs across the country become accredited by January 1st, 2012. If you're unfamiliar with accreditation or not quite sure how it works, don't worry about that. We're going to cover it here in the next few minutes. In order for a facility to be able to receive reimbursements on nuclear medicine studies, their accreditation must be completed and active by the end of this year. You might still be wondering if this applies to you. Here's a simple rule of thumb. If you perform nuclear medicine studies of any kind and you're not a hospital, then your facility falls within the parameters and needs to be accredited. Something else good to know is that if you are already accredited, you do not need to go through the process again until your current term expires. There are three types of organizations approved by CMS to perform this type of accreditation. The first is ICANL, the Intersocietal Commission for the Accreditation of Nuclear Laboratories, the American College of Radiology, also known as ACR, or the Joint Commission, which is TJC. All are equally accepted, but some make more sense for other facilities depending on the specifics of that practice. TJC is primarily for hospitals and is not applicable to any other type of facilities. ACR, for example, requires that you have a physicist perform quality control, while the others do not. ACR also charges per camera, whereas ICANL charges per facility. So depending on the specifics of your practice would determine which makes most sense for you. It's a lot of data to keep up with, a lot of information to assimilate, and a lot of forms to fill out. So InterMed offers assistance with the accreditation for all of our customers. And that way you can focus on what you do the best and what's most important, patient care. Once accredited, your facility won't have to go through this process again for another 3 years, which is the length of time that all three options are valid. It takes between 2 and 4 months to complete the application process depending upon the experience of the applicant, and it takes between 3 and 6 months to have the application processed once it's turned in. The three commissions vary in fees, so if you're not sure which makes the most sense for your practice, you should see an accreditation specialist. Something to keep in mind is that all InterMed customers receive a discount on accreditation services and consultations. Thanks for watching. I hope this has helped clear things up a little bit for you. For more information on accreditation, check out our blog at www.intermed1.com or check out InterMed on Facebook or Twitter for more industry updates.